Today we are here to talk about how we treat fractures. So at our clinic we understand that any trauma at any age brings a lot of pressure on the person as well as their family. For the older population, the major factors are their comorbidities. They are suffering from various diseases such as diabetes, hypertension, cardiac issues, which makes it very more difficult. The fixation also is very difficult in older population because of their weak bones. In adult population, the trauma is usually associated with high impact injuries. These injuries can lead to long hospitalizations, being away from work, can impact your income. In children, the main problem in managing these fractures are especially when they are related to growing bones, and these fractures, if not treated correctly, can lead to malalignment or can lead to delay in growth of one of the limbs, which can cause limb length discrepancies, which can be very difficult to manage in the future as well. So looking at all these factors, so we decide upon whether the fracture has to be managed conservatively, that's without the surgery, or the surgical intervention is needed. Because what we want is the early mobilization of the patient. For lower limb fractures, the weight bearing might be delayed for some time. We can start mobilizing them, we can make them sit, we can make them do their daily course activities. We want them to have a positive mental attitude that can be achieved with surgery or without surgery. So we start with proper diagnosis, and we engage the patient as well as the relatives into the treatment. So we discuss all the points, all the treatments that are available and what is good for the patient. Even with the surgery, everything is planned, everything is prepared well and informed to the patient so that everybody is at ease. The rehabilitation is very important aspect of the fracture management. We understand that, and our expert team of physiotherapists make sure that we optimize the rehabilitation. So during the fracture healing as well as post fracture healing, we make sure joints as well as your muscles are as good as they were as pre-fracture stage. So we try to mobilize, we guide you through various exercises, through various stages of bone healing, and advancing those exercises and movements through physiotherapy. So at Bombay Bone and Joint Clinic, we make sure that our team guides you and helps you throughout your journey and get you on your feet as soon as possible.